Hi everyone, we are the Biomedical Science Students Association of McNeil High School. Today we'll be talking about diabetes, a chronic condition which affects how the body uses sugar or glucose for energy. First, let's go over a little bit of background information. In order to acquire energy, your body needs to break down the foods you eat into glucose, which is released into your bloodstream to other organs or cells that need energy to fulfill their roles. When the level of glucose increases, the pancreas is signaled to release a hormone called insulin, which is the key that lets glucose into cells to give them energy. With diabetes, however, the pancreas is not able to make enough insulin or cannot use insulin as well as it should. Because of this, glucose starts to accumulate in the bloodstream, and when there's too much glucose present in the bloodstream, serious health conditions can occur, such as heart disease, vision loss, and kidney failure. There are two types of diabetes we'll go over, type 1 diabetes and type 2 diabetes. In both type 1 and type 2 diabetes, the pancreas' ability to produce insulin is impaired. Type 1 diabetes is an autoimmune condition that occurs when a patient's body begins to attack the pancreas. Alternatively, type 2 diabetes occurs when the pancreas is unable to produce enough insulin to correctly regulate patients' blood sugar levels, and occurs more often in late adulthood as a consequence of obesity or poor diet. Because type 1 diabetes is a condition not caused by diet, most of its risk factors are out of the patient's control. A family history where a sibling or parent has the disease can increase risk, as well as the presence of certain genes in the body's genetic code. Geography can also be a factor as type 1 diabetes cases become more common moving away from the equator. Type 1 diabetes is usually noticeable at two peaks in children, between 4 and 7 years old and between 10 and 14 years old. Main risk factors for type 2 diabetes include being overweight, inactivity or lack of exercise, an uneven distribution of fat mainly residing in the abdomen, being of Black, Hispanic, Native American, Asian, or Pacific Islander descent, having a family history of the condition, and aging, with risk primarily increasing after age 45. Other bodily conditions can also contribute to type 2 diabetes concerns. These include abnormal blood lipid levels involving low levels of HDL cholesterol and high levels of triglycerides, having polycystic ovary syndrome, a condition called prediabetes in which blood sugar levels are abnormally high, developing gestational diabetes while pregnant or giving birth to a baby over 9 pounds, and having darkened skin on areas like the neck and armpits, which can indicate insulin resistance.
The symptoms for type 1 diabetes tend to be more severe and immediate in comparison to prediabetes or type 2 diabetes, which in many cases manifests later in the body. Symptoms for type 1 and 2 diabetes include fatigue, frequent urination, inexplicable weight loss, increased thirst or hunger, blurred vision, and the presence of ketones in the urine. There are several ways to prevent type 2 diabetes. For example, scheduling a frequent workout routine. Exercises helps reduce high blood glucose levels as your muscles use up glucose for energy during workouts. Regular physical activity, ideally for at least 30 minutes a day, helps your body use insulin more efficiently. Patients can work with their doctor to implement an exercise routine to keep up their physical activity. Most researchers recommend post-meal exercises, saying that it is most effective in improving your blood glucose levels. Making sure to check your blood glucose levels and seeing how your body reacts to certain exercise can point you towards the most effective exercise for your body. Treatments often depend on the type of diabetes afflicting the patient. Treatment for type 1 diabetes usually involves insulin injections, frequent blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves lifestyle changes, such as monitoring of your blood sugar, along with taking insulin capsules. A key to many diabetes management plans is learning how to count carbohydrates to prevent glucose buildup. Meals should be well balanced, including starches, fruits and vegetables, proteins, and fats. Paying attention to the types of carbohydrates you choose can go a long way in preventing one from developing type 2 diabetes. Taking your medication is very important for maintaining your health if you have already been diagnosed with diabetes. For those who take insulin, it is important to remember that most forms of insulin must be stored properly, as it is sensitive to extremes in temperature. Additionally, medications for other health conditions can influence blood sugar levels, so each new medication should be shared with one's primary care physician. Remembering to maintain a balanced diet, participating in frequent exercise, and keeping track of medication can help those with diabetes to live long, happy lives. Of course, by raising awareness for diabetes, we can help contribute to important research that will better help diabetes patients. Thanks for watching. Make sure to give us a like and subscribe to our channel if you enjoy learning about all things biomed.